Hello, everyone, and welcome to the inaugural episode of SPIE's Voices of Vicissitude. My name is Mustafa Habib. I'm a second year medical student at the Al Khan University, and I will be your host for today. Today, we'll be speaking to our very own Dr. Sameen Siddiqi. Dr. Sameen is the current chair of the Department of Community Health Sciences. Besides that, Dr. Sameen has been the director for the health system development at the WHO, where he oversaw the work on health system development in 22 countries in the Eastern Mediterranean region. His work has taken him to over 60 countries, which has taken him to places like Lebanon, Egypt, Morocco, and Iran. And closer to home, he's worked as the senior health specialist for the World Bank, where he provided technical assistance to the government of Pakistan in the implementation of the health segment of the Social Action Plan. And furthermore, he was also the Chief Planning Officer for the Ministry of Health. One more notable achievement of Dr. Sameen was that he started the Health Services Academy here in Pakistan with its own Masters of Public Health program, and he's the current director of the program as well. Today, we'll be taking a look at multiple topics, including Dr. Sameen's journey through medical school, his journey from internal medicine to public health, and what his outlook is for Pakistan in the future. So firstly, Dr. Sameen, I'm very grateful for having you.
Well, thank you very much for having me. I look forward to having this conversation with you, Mustafa.
Thank you so much, sir. So walk us through it. How was life through medical school like?
Well, that's like the previous century you're talking about. I graduated over 40 years ago. And in those years, there were only so I graduated from Punjab. There were only three medical schools for men. So there was King Edward, Nishtar, and Bahawalpur Qaidi Medical College. And so I actually was only able to find a position in the Qaidi Medical College. But I really enjoyed my 5 years there. It was a small city. It turned out eventually that I was the best graduate for my batch, which I think was very gratifying. But clearly, I think in those years, we were very much driven by, clinical medicine. And so everybody wanted to do just clinical. So as soon as we graduated, I want to add that I did my house job actually at Jinnah Hospital in Karachi, because that was a federal hospital. And that gave me an exposure to work, with and meet with people from across the country. So it was a very good experience. I do recall it. It's a bit vague now that it's 40 years, but some of the things which I do recall, I enjoyed a lot of physiology, I enjoyed a lot of internal medicine, I enjoyed, a lot of things around surgery as well, but ended up being an internist.
Right. So you mentioned that you were an internist initially, but now you are a prominent figure in the world of public health. What actually spiked your interest in public health?
Well, before I get into that, mentorship is extremely important in every part of the world, and certainly in our part of the world. And I still think that we need the kinds of mentors which this country, that medical students, or in any profession for that matter. And mentorship has not necessarily been there. So for us, there was a lot of learning by doing. You learn, you see, and so our role models in those years, and even now for that matter, were very much clinicians. So the thought of public health was never there. So I did my internal medicine fellowship, and after that I became a consultant, and I was working in one of the big hospitals in Islamabad, the Pakistan Institute of Medical Sciences, first as an assistant professor and then going on to become. But one thing that I did realize, Mustafa, during the course was that in my department there were 40 beds. And I could not imagine that the rest of my 40 years or 35 years or whatever I had, I would spend around just those 40 beds and just be working there. So I thought there's life beyond, the clinical wards and so on and so forth. And so I wanted to experiment. And so I did get an opportunity to do a degree in public health, and I did that from London School. And I think it was there that it all changed, And it's interesting is that when I came back, I still worked as a clinician, which was great, and I enjoyed that. But then, I was gradually shifting my mind, and my interests were shifting towards public health. And then I got these opportunities, and then I made a big decision to move full-time from clinical medicine to public health. And I remember my clinician colleagues were very surprised. And I'm not talking of 2021, I'm talking of 1990s. Why am I moving to public health? And they thought this was a big error. This was a grave error on my part. But I thought I must take that risk, no risk, no gain. And eventually, I think it did pay off, actually.
All right. So, speaking on your experience, you've obviously traveled the world and you worked here locally. Can you tell us a little bit more about your work experience, specifically abroad, and then towards more local experiences that you've had?
But before I left the country, you see, I served in Pakistan for 20 years before I left for the rest 17 years or 18 years of my life that I spent outside. So if you allow me, I would like to spend 2 minutes of what we did before I left the country. Does that make sense?
I'm completely fine with that.
You see, when I moved to public health, I did all sorts of things in Pakistan, and there are a couple that I would like to highlight, and which is quite gratifying for me. The one that is that I started working in an institute nobody had heard about in the 1990s. It was called the Health Services Academy. Today, it is the biggest school of public health in the country, both in the public and the private sector. And I worked there for 6.5 years. And we developed the first master's program in public health. So why I'm saying that is that, my public health interests were I really learned public health not by being a student of public health. You're always a student of public health all your life. But when I actually became a faculty, that is when I really learned what public health is. And I had a mentor there, and I have to say mentorship matters. So there was somebody with the name of Khilman, and he was a person who had worked all his life outside Pakistan. He came to serve in Pakistan, so he and I worked together for many years. And I think he really influenced my thinking about public health. He taught me public health. He taught me health systems. So that did leave a mark on me, And eventually, of course, I went on to take other jobs. I worked for the World Bank, where before I left the country, I was in the country office, and I developed with the Ministry of Health the 1990 health policy of Pakistan. And I have to say that document remained the national policy document for a good 20 years. So I have quite a few things that I did before I left Pakistan. And of course, then when you leave your country and you serve in other countries, you again get the opportunity to learn so much more. And I'm happy to talk about that as well.
So, as I mentioned earlier to our listeners, actually, that you did work for the WHO. Can you tell us more about that?
That is correct. I did work for about 17 years. And it was a bit fortuitous because, frankly, I never thought, and I just got a call one day from a WHO person. He said, we want to recruit you in WHO. That's the way it happened. I didn't appear in an interview or something. And they said, can you send me your CV? And I had earlier been to WHO meetings a couple of times, and I was invited to those meetings. And so I just sent my CV, and after a few weeks or maybe a couple of months, I got an appointment letter that please come and join, which was, interesting. And so that was a change again, because previously I was working full-time as an academic, when I was at the academy. And then I moved first to the World Bank and with WHO. So I shifted from clinical medicine to public health, and within public health from academia to development work. And these changes are important. So then I joined WHO as a regional advisor in the regional office in Cairo, which sort of is for the Eastern Mediterranean, and that covers 22 countries. And my work was around policy and planning. Eventually, I then became also the WHO's representative in a couple of countries, including Lebanon and Iran, and I also served for many years as a director for health systems. Now, that gives you all kinds of exposures. You travel, so you go to some of the best part of the world. You go to Geneva, but you also go to Mogadishu in Somalia. You also go to Burkina Faso. And I think it gives you that breadth of experience, which I did get, as a matter of fact, So that was one. The other is, of course, you get to see the health systems of so many countries, and that's the learning that you get. So you see what is happening in Morocco, and you see what is happening in Egypt, and you see what is happening in Kenya, for that matter, And that learning you get through these kinds of works, which allows you. One thing I would like to say, and I think that's where so you can easily, when you go to a UN agency like WHO, you can easily become a international civil servant, a kind of a bureaucrat, and lead a pretty nice life. I think I did not necessarily opt for that, and I kept my academic side alive. So when I was in Lebanon, I was a visiting faculty at the American University Beirut. When I was in Iran, I was adjunct faculty at the Tehran University of Medical, and I used to teach courses there. And I used to publish, not as much as a full-time faculty would do, but I would publish a few papers, on a fairly regular basis. And I think that really kept my academic interest alive. And I feel very good about it because that also allowed me to come to AKU eventually, So there was a lot of learning, and of course you meet a lot of people with such broad and in-depth understanding of public health, health systems, and so on and so forth. So it's a continuous learning opportunity. While you are an advisor when you work for WHO, but I think frankly as an advisor, what you do is you learn a lot from countries. And what you learn in this country and that country and the other country, and then you try and package it and try and offer it to countries. And that's how a lot of the work goes on in these organizations, So yes, there was a lot of learning. But if you have anything specific, go ahead. I'm happy to respond.
Well, you did mention that you take a lot of it because of all of your international experience. You've learned a lot. Has any of that experience served as a template for any kind of policy initiative that you've taken in Pakistan?
Well, I don't think templates work. I mean, every country has its own. There are some guidelines, clearly. There are some guidelines, there are some principles, but there is no blueprint that you just take this from Thailand and put this in that country. Every country has to have its own pathway to reform. But there are some learnings, there's no question about that, Since you are coming to the discussion on Pakistan, yes, I did, and since I was also working with Pakistan quite closely in those years, I was a frequent visitor and I used to come and advise the government a lot, whether they listen to you or not. I mean, the problem with an advisory role, Mustafa, is that either you're going to give as much advice as you can, but it's for the government to see whether they listen to your advice or not. Some governments listen more, others don't actually, or others at least listen to you, but then it's all lost and forgotten basically. So, and I'm to be very honest, my advice in Iran was extremely seriously taken, and the 2 years that I spent there, I have to say it was a pleasure to work because there was a very high level of commitment by the government and the Ministry of Health of Iran. And they were undertaking a major health sector reform towards universal coverage. And it's very gratifying when they take your advice, they follow this, implement it, and so on and so forth. It has not necessarily been the case like in Iran, but in Pakistan also things have moved, but they have moved rather slowly. And that is for me the challenge, how to speed up some of these reforms. And I can talk about some specific ones. One that I want to talk about in Pakistan, which I have been heavily involved with when I was there for almost 8 to 10 years, was the one on decentralization. Now, I don't know whether you know this, I'm sure you know this, but Pakistan in 2011, I think, made a constitutional amendment, among other things, to devolve health and education and social sectors to the provinces. And to the extent that they completely abolished the Ministry of Health at the federal level. So everything became provincial. And I think that was an extreme reform and we were not prepared for that. And I was heavily involved in advising the government on how to at least, of course, strengthen the provinces, but also bring back some capacities at the federal level. And it was not just me, there were many people. And I got a team from Harvard to come with me when I was in WHO, to sit with the government, to advise the government. And interestingly, the one country which was extremely devolved was Canada. So Canada has 10 provinces. And the Canadian provinces are extremely devolved. I mean, they run their health, but they're, of course, far better equipped, far more capacity, far more resources. But even there is a central thing in Ottawa, there is a Health Canada, there's a Ministry of Health in Canada, And so we brought a lot of these experiences from all over the world. Well, thankfully, the ministry has been re-established for various reasons, but it was quite a challenge when it so happened that there was such an extreme form of devolution in health in Pakistan in 2010, 11, 12, 13, and so on and so forth. That's just one experience I thought I could share with you.
That's understandable. But now that we're on the topic, this was obviously a limitation, and I would go, maybe you'd agree with me, or maybe you disagree. It handicapped the provinces to basically respond to any kind of health situations in Pakistan. What kind of limitations do you see in Pakistan's current public health sector that we need to address right now and moving into the future, especially given the context of the pandemic that we're kind of in right now?
So there are quite a few things in your question. It's pretty, Let me first, since we were talking about this decentralization or devolution business, I want to just say one more thing. Pakistan is a big country. We are the 5th largest country population-wise in the world. We have 150 plus districts in the country. And, the real devolution in Pakistan is not from the federal to the provincial level. The real devolution in Pakistan is to the district level. I mean, a district in Pakistan could be as much as 2 million people, 3 million people. I mean, 3 million people is the size of Finland. 5 million people, Gujranwala would be 5 million people. That's the size of Jordan, you know. So where the real devolution needs to take place in Pakistan is at the district level, and it is not taking place. And that's a very important reform for this country. You know. So that's one, from a governance point of view, it's a big, you know, deficiency in a sense in our system. We need to have, and I'm a strong proponent of that, of a strong district health system in the country. So that the delivery of services gets closer to the people, the decision making gets closer to the people, and I think it will make a difference if we have stronger districts than what we have now. So having said that, of course, there are many other challenges. The other big challenge, so this was the governance point. The other big challenge, of course, in Pakistan is we are a big underspender on health. And if I give you some numbers, it's a bit you know, worrying, if not shameful. So what we spend is about $45 to $46 per capita on health every year, of which a good 2/3 is spent in the public sector. So the government spends about $14 to $15 per year. The startling figure, which you all might know, is that in the US, the per capita spending is $10,000 plus. So $45 and $10,000. I'm not saying US is doing well. I'm not saying that at all. But I'm just giving you the stark difference that there exists. So, but if I even look at Iran, Iran spends about $450 per capita, and we spend $45. So there are huge gaps in our funding, and so that's another big gap, you know. In the more recent context that you're talking about is COVID. Well, obviously, I think Pakistan has not done bad in COVID. I mean, that's one area where I think, at least we have done relatively well, and there could be reasons we can talk about that. Have done well. However, one thing that has come out very clearly globally and in all countries, and certainly in Pakistan, is the weak public health system. And within that, the weak surveillance system and the response system. And I think in future, if we have to ever confront these kinds of epidemics, and even now, as COVID waves keep coming up every now and then, we need to have a much better surveillance and response system, which is to a certain extent lacking. And of course, now we need to vaccinate our population at a very fast pace. And unless that happens, I can see future waves happening in Pakistan, you know.
That's understandable. So now that we are talking about it, will this pandemic change anything moving into the future, in your professional opinion?
Change in terms of what?
Will it bring about the next generation of public health professionals? Will it bring about a revival of the public health sector?
So public health, so COVID has been a wake-up call for all governments, I think, both in the West, in the North, and in the South. It's been a wake-up call for all of us. I mean, I think we were all caught unprepared. I've never seen health being a subject of discussion in the cabinets of countries as it has been in the last 18 months. So health is clearly high on the agenda. And I think this opportunity from a health perspective should not be missed. And we need to really invest in health. I mean, investing a few $1 billion in health can save hundreds of billions of dollars, if not trillions of dollars globally, you know. And I think that we have gone through this kind of an experience, and I don't think we need to convince ourselves of that, you know. And that is why I think not only in Pakistan, but I think there needs to be a global, and there are movements that I know of that to invest in health much more than what has happened. So in Pakistan, I think much more is needed in terms of investment in health, in public surveillance systems, and hopefully we should be able to confront these epidemics or these pandemics, and not to forget the epidemics. I mean, pandemic has taken over, but I can tell you there has been an epidemic of hepatitis in recently, an outbreak in Larkana of HIV, an outbreak of drug-resistant typhoid fevers. All these things add up, you know. And so I think we need extremely robust surveillance and response systems to be able to address these challenges that confront us very, very frequently.
Right. So you've obviously worked in this sector for a long time, and you've been talking about how we need to focus on incredibly robust and comprehensive surveillance systems. A lot of these surveillance systems require comprehensive plans. And as a public health professional, can you tell us and our listeners about what it really takes to actually plan such a measure out, and how do you actually execute it so that you can actually have a meaningful?
That's a great question. That's a great question. So that's a great question, Mustafa. So here is the way I would say it. Obviously we have a policy. We have many countries that I work with have national health policies and so on and so forth. And then they do get translated into plans. Now, planning is done, again, I would say, at two levels that I would say, although they're related, but one is the more strategic planning that is done, and I think I'll talk a bit about that. And then, of course, how do you operationalize it and do your operational plans and implement those plans, Now, what we have to do in many of our countries, including Pakistan, and I'll talk about Pakistan because that is the country of interest at the moment, is that we need to have a well thought out, strategic plan, which is not just looking at surveillance, but which is looking at the whole health system in a more holistic manner. And I think that has not necessarily happened. And today, if you ask me, COVID, of course, has overtaken everything, but the biggest global movement in health, which has been taken up by at least 70 countries, is to advance countries towards what is called universal health coverage. And whether you look at India, or you look at Iran, or you look at Bangladesh, or you look at Brazil, South Africa, almost every country, or Mexico, is actually, that is their big goal of how to. And what does it mean? What does universal health coverage mean? And let me spend 30 seconds to explain. Because there is something important about universal coverage. And that is, we need to be making sure that health is accessible to everyone. But in the process of providing health care, we should also ensure that people are financially protected. We don't want people in the event of an illness to become, or households to become impoverished or incur what is called catastrophic expenditure just because somebody fell ill and they're seeking. That's what universal coverage is about. So it's not just about providing care, it is about providing quality care and ensuring people are protected. And that's, for me, the big thing that every country has to move towards. Before I finish, so our health systems now need to be geared in those directions to be able to help countries move that. And along with this big thing, we need to ensure what are called essential public health functions, which is about surveillance. So if we move in this direction and this is the strategy, then we should be able to, make a big dent in the performance of our health system. The second part, of course, is how we implement it. And unfortunately, we are bad implementers in this country. We have to enhance our capacity to implement. That is why I am such a keen supporter of district health systems, because implementation takes place at that level. And unless we build capacity to implement at that level, so in Thatta, in Bannu, in Muzaffarabad or Muzaffargarh or in Kalat, unless we can have all sorts of policies, Mustafa, but unless we have the capacity to translate those policies into implementable programs, we'll never be able to reach the common people of this country and provide them a decent package of health services. That's why I'm such a strong proponent of district health systems. Sorry, I get a bit passionate about it, but I thought I must share my views with you on.
No, it's definitely an important step that we need to take, even in my opinion. And the signs do point towards us moving away from out-of-pocket payments. I think the rate has decreased as a gross percentage. It's dropped from around the high 60s to the high 50s, if I'm not wrong. But it's definitely an incredibly important component of public health, especially moving into the future, a future where we might see more pandemics, as the WHO says. But now moving away from that, and because we're running short on time, a lot of people go into medicine, including myself at least. We went into medicine thinking about medicine being limited to fields such as internal medicine, cardiology, pulmonology. But now, given the relevance of public health today, how can we increase prospective medical students, both now and in the future, to actually move towards public health? What do we really need to do as educators, as professionals, to actually get people moving towards that sector in particular? Because especially in Pakistan, we definitely need a lot more of it.
Correct. And again, a very important question, Mustafa. So my premise in this is that not everyone needs to become a public health professional or a public health physician, okay? But, there's a but to it, and that is that when medical students go through training in their medical schools, and later on as well, everyone needs to be oriented to public health. So a pediatrician, a surgeon, a internist or an obstetrician, all should have a strong and sound orientation to public health. And I think that's extremely important. Everyone has, and even nurses for that matter, and just not the medical student, the whole profession for that matter. Out of that batch, maybe 5% of the people might take up the profession, and that's fine, and become, or 7% might become public health professionals. And that's the way it should happen. But the overall orientation of the workforce towards public health in countries like ours, or for that matter, any country, is absolutely essential, And today in this amazing university, AKU, I can tell you, when I work with Athare Naam, he's totally public health oriented. Zulfikar Bhutta was a pediatrician, he's a leader in public health globally. Okay, Adil Haider, our dean, is a qualified public health professional despite being a trauma surgeon. So you can see that these smart people, all are extremely well oriented towards public health. And that is going to be the future. That is what is needed. So extremely important that everyone has the orientation. Not everyone has to become a public health person, but that orientation is extreme. And that's what I would say to medical students today, that please, and in simple words, and since we were talking of universal coverage, when somebody is walking into your clinic just to receive health care, don't just prescribe without thinking what is the economic background of that person. You need to sometimes think of that more in our situations, because you don't want to be putting these people at the risk of becoming impoverished. It's just one manifestation of being oriented towards public health, to being more socially accountable, socially responsible, as part of our ethos in medicine.
That's completely understandable, Dr. Sameen. We are now kind of out of time now, so I really want to end this by thanking you so much from our side here at SPIE. We haven't had the opportunity to talk about SPIE in great detail, so for context for you and for our listeners, SPIE is the Society for Promoting Innovation in Education. This podcast is one of the myriad of programs that SPIE is trying to take initiatives in. This is particularly one of our wings projects called Community Wing. So a lot of our work moves into things like providing BLS, which is basic life support training for faculty. There's also a massive educational component to what we do. And do you have any idea about it? Do you have any?
Well, I'm learning, and since I've had several meetings with you, I think you've learned more about it. I'd like to know more about it, as a matter of fact, but I'm quite impressed with the work of the Community Wing of the Society for Promoting Innovation in Education. I think you're doing some amazing work. I think it has far reach, and people will listen to this, people will be inspired by this, and I think this is a kind of an innovation that you're doing. So, great initiative. I wish you the best, and happy to support this from my department's perspective in whatever way is possible.
We're incredibly grateful for your company, Dr. Sameen. We really hope to see you again on this show another time.
My pleasure, and thank you very much, Mustafa. Pleasure talking to you. Have a nice day.
Thank you so much. Thank you, everyone. We'll see you later.